You look in the mirror one day and bam, the hairline is starting to make an early exit.
It's Doctora Victoria and George.
Male pattern hair loss, it's one of the most common issues men face. But don't worry, because today we're diving into why it happens, how we can slow it down, and what you can do to keep those luscious locks looking their best. Or you could give up like George, but it's okay. I still think you're fly. So what exactly is male pattern hair loss, or MPHL? It's a genetic condition where you lose hair from specific parts of your scalp, usually the front, top, and crown. This happens because of a hormone called dihydrotestosterone, or DHT, which shrinks the hair follicles over time, leading to thinner and weaker hair. And that's when things start getting, well, thin. That's why some men notice their hairline creeping backward or see thinning at the top. It's a slow process, but if left untreated, it could lead to permanent hair loss in those areas. It doesn't usually happen overnight. Most guys start noticing in their 20s or 30s, though it can happen earlier or later. It depends on your genetics, and it all boils down to that pesky DHT. Too much of it and your hair follicles get weaker, smaller, and eventually stop growing hair altogether. But let's talk solutions. What can you do if you started to see some hair thinning? I have a few of the most common treatments that we use for male pattern hair loss. First up is topical treatments like Minoxidil. This is the go-to for most people because it's easy to apply. But listen, you have to be patient with it because it can take at least 6 months to see real results. And there's an initial shedding phase. That means you lose your hair. It freaks a lot of people out because it pushes out the old hairs to make way for new growth. So if you notice more hair on your pillow or in the shower early on, don't panic. It's usually a sign that the treatment is working. But it is important to stay consistent. Once you stop using it, any gains you've made can be lost in a few months. The side effects, well, they're pretty mild. Some people experience scalp irritation or redness, especially with the solution, but switching to a foam version often helps to reduce that. And for people who prefer oral medicines, we've got something called Finasteride and Finasteride. These are a little more serious and work by blocking a hormone, that DHT, which is responsible for the shrinking hair follicles. Finasteride is usually the standard, but for those who don't respond well, we'll do that Finasteride. It's a little bit more powerful as an alternative. We usually use these when Minoxidil isn't enough, or if you want to go straight for something more potent. And if that doesn't do the trick after about a year, we might move on to that stronger Finasteride. Now, these pills come with some baggage. The most common side effect you'll hear about is sexual dysfunction, lower libido, erectile issues. It's rare, but when it happens, it's a big deal. The kicker, guys report these problems even after stopping the medication. There's also a slight risk of gynecomastia, which is breast tissue enlargement. And the meds mess with prostate-specific antigen, or PSA levels, and this is something we doctors use to monitor your prostate health. So if you're on these medications and your PSA gets tested, make sure your health care provider knows. And for those who want something a little less invasive but still effective, there's photobiomodulation, aka low-level laser therapy. These devices are pretty cool. You wear this laser cap or you use a comb and they send light to the scalp to stimulate hair growth. It's pain-free, but again, you need to stick with it long-term to see results. Side effects are almost non-existent, but some people might experience mild scalp irritation or headaches. Hair transplants, this is for those who want permanent results. It's the most invasive option, but delivers the most dramatic and lasting outcomes. Basically, it involves moving hair follicles from areas where your hair is still thick, like the back of your scalp, to the thinning areas. It's a surgical procedure, so you can expect some downtime and potential side effects like scarring, swelling, and even infection if things are not done properly. But if you're looking for a long-term fix and are okay with the higher price tag, it's definitely worth considering. So there you have it, a breakdown of our most popular treatments for male pattern hair loss and when we recommend them. As always, it's important to talk to your healthcare provider before jumping into any of these treatments, especially the oral medications, to make sure that they're right for you. And remember, there's no one-size-fits-all approach. Your treatment plan should be personalized for your needs, comfort level, and how much effort you're willing to put in. Consult with your healthcare provider to make sure that you are on the right path. Remember, these treatments take time, often 6 months to a year, to see real results. and you need to stick with them to maintain the progress. Thank you for joining us today, our healthcare team. I hope that you'll join us next time. Bye-bye.